Hi everyone, I'm Dr. RakheeYadav, consultant pediatrician. Welcome to my live session today. It's an interesting topic, the new era of telemedicine. Let me just try to add Dr. Kaajal in. Give me a minute. Hi Dr. Karan, welcome to my live session. So today's topic is telemedicine or telehealth in some cases, and I think it's a very interesting topic because it's something that we're moving forward with. Hi Kaajal, how are you?
Hi Rakhee, long time no see.
Well, yes, long time no see. Welcome to my live session. Thank you so much for joining me live today. I was just telling our viewers that the telemedicine or telehealth, as some call it, it's a new thing. It is something that is moving forward and something that is not discussed very often, but we should all know about. So thank you, Kajal, for coming on live, and hope to get more knowledge from you about it. And I know that Kajal is actually a doctor from Singapore. She's an emergency physician, but she's also working with Whitecoat Medical, right? Which is a telehealth company, and she's going to tell us a lot more information about that in a bit. So, hi, Kajal. Would you like to tell us about yourself?
Sure. Hi. Hi everyone. I'm Kaajal. I graduated from the University of Leeds more than 10 years ago now, if I have to admit. I was doing my housemanship in UK for a year, and then I moved to Singapore, and I've been there since. Throughout this time, actually, I was doing a lot of exploring. So I did a lot of acute critical care, and then ended up mostly loving emergency medicine, as well as now telehealth, which I just joined about 2 years ago. So I've been with Whitecoat Medical for the last 2 years.
Excellent, excellent. So why don't we dive straight into it, and I'm going to ask you the question of what is telemedicine? Would you like to tell us what it's all about?
The golden question, yeah. So it
Yeah.
is what its name suggests, telehealth. Yeah, it's under the umbrella of telehealth, and it's a way a patient, or rather a way patients can see their doctors in the comfort of their own home, hotel rooms, or even in their bed in some cases, and get counsel, get advice, medications without leaving where they are. It's sort of like an online clinic, but you see your doctor through an electronic platform.
And what does it involve? Like, what does a doctor or a patient need to be a part of it?
Okay, so to sort of navigate, I think through the sort of concept of telehealth, it is not like your conventional medicine where you're face to face with your doctor, like our olden days. I like to say olden days, but how it works is you make an appointment, you go down to clinic, you tell your doctor your problems, they issue you some medications, examine you, and then send you off on your way. Now, telehealth is slightly different in the sense that there is no face-to-face meeting. What it is you dial in through our app. We talk to the patient, so a patient can select a doctor to see. In certain cases, we've got a prelim questionnaire that you can actually fill out certain symptoms, and then you talk to your doctor regarding your symptoms. You get connected by a video call, similar to what we are doing now. The only difference is that we, talk to them about, the symptoms, diagnose them without the examination point of view, and then we prescribe medications. There's a clause there when I say without the examination. We can actually do more of a self-directed examination. And I think as a doctor yourself, Rakhee, you know that you can tell if someone is sick within the first 10 seconds of meeting them. So I think a lot of the observation skills come in play with telemedicine.
Excellent. So you've mentioned a couple of things that how it differentiates normal consultation when the traditional, I'll say traditional because I'm not so in the olden days yet. So the traditional way is where you make an appointment and you physically see the doctor examines you, touches you, not with a pencil, touches you and makes sure everything is okay. But the virtual aspect of it would be like exactly like what I'm doing now with Dr. Kaajal, and we see each other. And I think from my aspect, the pediatric aspect is I must make sure that the child is somewhere in view of the video as well. And I just did one consult today as well. And the child was running around in the background. So which means observational skills is the child can stand up and run.
Yes,
So obviously he's cheerful and he's well, So yeah, you can rule that out. He's not bedridden. He's not, lethargic or anything. And so there are a couple of things that you can do by observation, but it still does not it's not on the same level as doing a full physical examination. So I guess these are just a couple of things to differentiate. Are there any other ways of differentiating between the virtual and telemedicine consult?
I think you've highlighted actually the main point of telemedicine. Yeah, it's the fact that we can augment or assist, maybe replicate a lot of the consults that you can have in clinic and sometimes even in hospitals, but it doesn't take over emergency, acute, critical care, and a lot of things that unfortunately needs to still be done in clinic. What I mean to say is that examination is important in sort of examining a patient in a consultation. A lot of things that sort of can be done via teleconsults may not need an examination, and this may be things like repeat prescriptions, for example, or someone who's got kids of blood pressure at home, and they can sort of convey that information to me. So yes, highlighting your point, examination is important. It does come in play with a lot of cases, but similarly, telemedicine can take a lot of that away with certain cases that we deal with.
Excellent. So what are the kind of suitable patients that are basically for telemedicine? So when you say renewal of medications, the first thing that comes to mind are chronic patients. So maybe someone with epilepsy, someone with diabetes, someone with hypertension. But any other patients that you find fit the suitable criteria, rather than blanket rule everybody suits it, you know?
Okay, so maybe this is where we can raise a bit of awareness, yeah? So we can handle a lot of acute and chronic cases. And for those of you who want to know what acute and chronic cases are, acute cases are those that change on a daily basis. And chronic cases are things that don't really change on your daily basis, things like your weight, which unfortunately you want to go down like almost immediately. Now, we can handle things like headaches, for example. And when I say headaches without red flag symptoms, for doctors, they would understand. For the non-doctors who are listening, these are things that doctors criteria as things that are serious. For example, vomiting, loss of consciousness. Yeah, so we can handle the acute, simple cases or the non-emergency cases, and these are things like your gastric symptoms in someone who is known to have gastric problems, someone who's got leg pain, or you go for a 10-kilometer marathon and you have some strains. So those kind of things. Repeat prescription for chronic patients with blood pressure problems, cholesterol problems. And right now, we also do home-based health screenings. So we can actually monitor that they are taking their medications and optimizing their care. And we can follow up these patients that are under our radar. So this would be deemed suitable patients. But of course, as we are going along, we are seeing a lot of unsuitable cases, or we are learning the process as we go along because it's a new branch of medicine. And the unsuitable ones will, of course, be your emergency and accidents where we cannot administer first aid.
Absolutely, absolutely. So if you have been in an accident, please don't go and try to organize a virtual consult with your doctor. Please bring yourself to the nearest emergency. So anything that is deemed emergency, or like Dr. Kaajal said, acute care, definitely requires a proper full examination, because we want to make sure that we don't miss out on anything that we may not be able to see on a 2D image like this, because sometimes you need to see the whole body, examine different aspects of the body with different instruments as well. So equipment in the hospital cannot be the same thing as equipment that you have at home. Like some of us, even though we're hypertensive, we have our own BP monitor. It may not be the same as the ones that we have in hospitals. So these are just a couple of things together with that. I think just to mention here that recently COVID patients have also moved on into virtual CACs as well. So that's something that I want to mention, that to those of you who have been diagnosed as COVID positive recently, it's not a necessity for you to rush to a nearest CAC. We don't want to clog up those CACs. So there are virtual CACs that you can find on the JKJAV website, or the vaccinecovid.gov.my website, or the KKM website. There are hotline numbers that you can go for, or even on your MySejahtera app, you can open it up and they'll give you the numbers for a virtual CAC. Some hospitals, some clinics, we also do virtual CACs. And I just wanted to mention that this is where my clinic also, we have started virtual CAC for children who are diagnosed as COVID positive, where we will monitor you daily and we have a regime that will follow. So if anybody needs any assistance in that way, do approach the right authority. We have a question that just came in. Do doctors need to be based in the same jurisdiction as their patients now? I don't understand. Very insightful. Is this the future? Oh, very insightful. Is this the future? Sorry, I didn't see the beginning of the question. Is this the future? I have a feeling, yes, this is definitely in the future. So do doctors need to be based in the same jurisdiction as their patients now? You want to take that, Kaajal?
Okay, so maybe it is one of the branches of the future of medicine, and I think telehealth is an exciting journey or an exciting platform where I think with AI that is now being incorporated in certain countries, I think we can say that there's potential that this is going to be the future and it's going to expand and it's going to be used more. In terms of the question where doctors have to be in the same jurisdiction, we have had a lot of calls and consults with limitations, of course, from people overseas in terms of advice, in terms of health screening results, just general counsel on things that they want a second opinion on from various places. But of course, if medications are involved or an examination is involved, then we are limited in that aspect, just like any other patient that we are seeing by a teleconsult. But yes, we can see patients from all over the world for a second opinion or counsel.
I also like to just put in there that if you are a pediatrician like me, I'm not going to go and see a gynecology patient, and neither is an orthopedic surgeon going to be seeing a gynae patient. So, so in that sense, that jurisdiction of your specialty still stays. So don't make an appointment to see a favorite doctor of yours just because you think that doctor's got telemedicine and is going to be able to help you with problems that are not associated with his specialization. So I think this is something that's really good because telemedicine, like you mentioned, is not only nationwide, it's not only statewide, district-wide, it's worldwide. And it actually started off when some of the bigger hospitals in certain countries could actually link with district hospitals. And that's how we sort of did some telemedicine, especially in the rural areas. And this is how some of the big specialty hospitals could get their specialists to speak to district officers, doctors that maybe don't have that specialty on a regular basis so they can consult with regards to their patients. So yeah, so it's worldwide, nationwide, and we do have it in Ministry of Health as well. And I'm sure Dr. Kaajal will mention that it's also available in Singapore, right?
Yes, absolutely. I think it's gaining popularity. I think with COVID, the pandemic, we have got a lot more patients calling in because, of course, with COVID, the main issue is the COVID and the pandemic itself. But let's just not forget, well, that other ailments are still there. Your chronic conditions, your pressure problems, your migraines, the sickness are all there. And that's where we can reduce that risk of getting patients into clinic, and we can help them out by addressing their concerns. So it is gaining popularity. I think people are becoming more aware of it, which I'm very proud about. So hopefully people will be able to utilize this for the right reasons, of course.
Exactly. So what are the difficulties that you see in some of these patients from a patient perspective as well as a doctor's perspective? What do you think are the difficulties that we face besides Wi-Fi connection?
I think that's the main thing. I think with technology, telehealth, we're to sort of perfect the technology. And of course, that will depend on the phone, the Wi-Fi of the patient itself, especially if someone is calling from a rural area. But I think the main difficulty, I think, is maybe expectation. And maybe I can branch it out to two areas. Expectation in the sense that, like I said, it's not a conventional, or we're using the word traditional way of medicine. So I think the expectation of what a patient wants to see, or what they see, or what they navigate through the app and see the doctor may be something very new, very different, very maybe uncomfortable for some people in terms of what they can and can't do and what they can and can't say in front of the doctor. For example, if it's something related to a sensitive topic. So I think that expectation in what you can expect from a doctor, what you can discuss because you're in front of a computer rather your phone rather than in person in a room. And in that same time, I think the expectation of that is not conventional medicine is getting the awareness of people. I think with time that will solve that problem. The other branch of expectation, I think, is that people don't want to leave their house, and the expectation that telemedicine can do everything. And I think that's where the difficulty comes in terms of sometimes we have to explain that certain things in terms of safety of patients, we just simply cannot see via teleconsult. And that could be people with abdominal pain, which we can see that they are in pain, and we simply cannot treat because it's not a responsible thing to do without an examination. So the expectation in terms of the conventional things, in the conventional expectation, and too much expectation in what it can offer.
Exactly, and I think the assumption that it's a do-it-all. I get to see the doctor on the video, which means she'll be able to diagnose me, treat me, and give me all the medications I need, and I don't have to go anywhere else. So that assumption needs to be, adjusted. And you definitely need to know that this, at the end of the day, it's a 2D image versus a 3D image, like a 4D or whatever. So if I see you personally on a virtual image, it will give me whatever information that I need, up to maybe 70-80%, but that remaining 20-30% is where the physical examination comes in, just to maybe confirm everything and give you a proper diagnosis for follow-up. So one thing to note, in our country, I think most teleconsults are done only for follow-up visits. They don't actually agree for first patients because of the fact that we don't know who this patient is and we don't know the background, and we have never examined this patient. It's purely for all those aspects of it, and we may miss certain aspects that will give an extra benefit if we see the patient first. But for follow-up cases, I think shouldn't be a problem. So yeah, so like you mentioned, there are doctors' point of view where they feel they can see whatever is happening with the patient, and from the patient's perspective is they feel that they know everything and the doctor will be able to do everything for them. So both sides' expectations need to be met, and I think in that sense, when you have a pre-consult call, or when you already have a predetermined disclaimer instructions before you go on a telemedicine consult, most of those things will be answered there. Every facility has a different rule, has a different regulations, and they have all these things. So wherever you go and click, like if you click in my hospital, they will put in there, these are the amounts, these are the things that they will follow up. So some places will provide delivery of medications as well. So some places will, so if you need certain things, we can always upload and deliver the medications to you. So just to keep you safer at home as well. So this has been really interesting. I think Dr. Kaajal and I, we've been discussing about telemedicine, telehealth, and this new era where we see this is going to be the future of medicine. And we've talked about several aspects of what is telemedicine. She's talked about the benefits of telemedicine at the moment, as well as the difficulties faced by some patients and doctors. Would you like to add anything else before we end this session, Dr. Kaajal?
No, Rakhee, thanks for having me. I think it's a new branch of medicine. I'm learning as I go along as well. And I think the main thing is actually that creating awareness about telehealth is not only to encourage people to use it, but like I said, to encourage people to use it for the right reasons, and delivery of medications and all, sort of putting a clause up. I think we will learn as we go along, because as you see in normal clinics, or I don't want to say normal clinics, in sort of physical clinics, we may face the same difficulties of turning patients away. For example, you are a pediatrician, you're seeing orthopedic cases, and I'm sure that's happened to you. But the whole idea is that in this current pandemic, I think telehealth has become more popular, because people are trying to stay in their house and get consult advice and medications. And I think that's where we come in to assist in this pandemic, to try to help to take the burden off hospitals in that aspect. And also to try to encourage people in the right direction if they've got flu-like symptoms, without exposing themselves to public environment or public transport. So I think we've got a long way to go. It's a new branch of medicine rather, and I'm happy that we've had this talk, so maybe more people can have some questions answered. So thank you for having me.
Thank you, Dr. Kaajal. I'd just like to end with one of my aunties. She's quite old. She's about 80 plus. And I remember her saying that she doesn't go to the doctor because the doctor is handsome or because the doctor gives her the right medication. It's just because the doctor sits and listens to her. So in telemedicine, one of the things that we as doctors, we do is we listen to you. And sometimes all a patient needs is someone to talk to and listen to and give you the right sound advice, or point you in the right direction in case you need something else, you need a referral, or you need some other direction of where your health is going. So with that, I think, thank you so much, Dr. Kaajal. Someone has just mentioned a great stuff. The future is here. Looks like this will be more effective in this lockdown NCO times. Yes, Uncle Vijay, yes, definitely. Thanks for the information, Dr. Kaajal, we have from Rufin. So this has definitely been a very interesting talk, Dr. Kaajal. Thank you so much once again. And I hope to see you physically soon someday. But yes, till then, stay safe and take care.
Stay safe. Bye-bye.
Yeah.
Bye, everyone.
Bye-bye. Bye. Bye.